your mouth.
All right, we are back with HTV's dental expert, Dr. Ryan Walker. Great segment last week. This week, another great segment. Doc, good to see you.
Good to see you, Martin. Thanks for having me.
Dental anxiety. A lot of people have it. Do you see it a lot?
Most people have it, believe it or not, to some form or another, some extent they have it. It's probably one of the top reasons for not going in to see the dentist.
Now, is this something that if you get a child that comes in to see you, that they learn from their parents? Is it passed through generations?
It can be passed through generations. Unfortunately, some parents do discipline, threatening to take their kid to the dentist, which is probably the worst thing you can do. It makes my job way harder. So, if your parents don't do that. Yes.
Right. Some people are claustrophobic. Does that come into play a little bit?
Claustrophobia definitely comes into play because for me to work on you, I have to get in your personal space. And for some people, that just gives them anxiety. For other people, it's, it could be fear. I have a patient that has fear of drowning. We use water to work on you. Pretty much everything we do, we use water. For some people, it's a bad experience. Whether you're a childhood or an adult, it's just a bad experience. And people just have a lot of anxiety with the dentist.
For people who have that type of anxiety, does that fall in your realm of expertise, or is that another avenue to get help?
So really both. It's my job to help you with your teeth. It's my job to help you, to give you, comfortable, confident smiles. But it's not my job to rehabilitate you on your phobias or fears. It's just my job to deal with them. If you do end up overcoming your fears through several visits and you find out that it's really not that scary of a place, that's great, but we do not expect you to, which is why we have options for you to get over your fears.
And the fears may come from different avenues, and one of them may be they're just a little shameful of the way their mouth looks, but you deal with this all the time, right?
Yes, you shouldn't be embarrassed. Everybody needs help. Just because you have dental anxiety doesn't mean you don't have teeth. The teeth are still there. You need to take care of them. So there's a lot of people suffering out there. Have a lot of shame, but you shouldn't be. The dentist should not be a place that's going to judge you. You should come in.
Sedation dentistry, we've heard that term quite a bit, especially recently with social media. But what does it look like in your office?
So this is our tool to help reduce hurdles to people getting treatment. Sedation dentistry really helps out a lot of people. We have 3 options of sedation dentistry. We can do laughing gas or nitrous oxide, which a lot of people know about. It's been around forever. You can do pills, which is oral sedation. It's just pills that you would take before you come in. It really relaxes you. And the last most intense form of sedation would be IV sedation, which is something typically reserved for oral surgeons, but some general dentists also do this.
Do you find that people that come in and maybe need a little sedation on the first couple of visits, once they realize it's not so threatening, they don't need to take it?
Sometimes yes, but sometimes no. Some people, that fear is going to exist forever, but for people that do get over it, that's great, but we don't expect that of you.
Let's bring a picture up if we can to sort of give people an idea. What are we looking at?
So we're looking at sedation dentistry in my office. This is a nitrous oxide case or laughing gas. Oral sedation looks very similar. Patient comes in, we block out chair time to get them to a point where they are comfortable. We give you a blanket, we turn off the lights, we get you as comfortable as possible, reduce as much stimulation as possible, and we just get you to a state where we ask you a permission statement if you are comfortable to proceed on with the visit, or do you feel nervous at all? And when you say, no, I don't, well, then we proceed. We don't proceed until you say, I'm comfortable, I'm very relaxed.
That's comforting in itself to know that they are in control.
They are, yes.
Of the situation. Let's roll a testimonial that we have. Here's an actual patient that did a testimonial.
My dental anxiety started a few years ago at a different office where I was having some work done and I wasn't fully numb. The dentist kept going and going, and it created an environment where I started to get really nervous every time I went to the dentist. It's hard to admit, I guess, at times that you have anxiety because this isn't really a scary place, which is when I started coming to Dr. Ryan Walker, and I know that now he's got laughing gas. And the last time I came to get my teeth cleaned, I actually did try the laughing gas. And I was surprised. It was a very, very relaxing visit. I needed some dental work done after my last cleaning, and I'm here today. And I can tell you that I am not nervous at all. I'm looking forward to the visit. It's not something that I worried about prior to coming here. And I'm extremely relaxed, and I think that this laughing gas is definitely the solution to the dental anxiety that I was experiencing.
Wow, she said it very well. I was thinking of the phrase we all know, nothing to fear but fear itself. But that fear is real sometimes, but she seemed to have gotten over it pretty well.
Yep, dental anxiety is very real. It's something to be taken very serious. And like I said, a lot of people are very reluctant to admit they have it. But until you do, I really can't help you. You got to get over that hurdle.
Right. All right, there you have it. Our dental expert here at HTV, Dr. Ryan Walker. And give him a call, him and his staff. And if you've been one of those that just haven't visited the dentist because of the fear factor, just know that there are steps. And remember, you're in control of whether or not he proceeds forward or not. I think that was a very key part of the show today. So give Dr. Ryan Walker a call. We appreciate the good doc being on once again, and look forward to each and every month you coming on for a new tip.
Thank you, Martin.
All right, there you have it. Dr. Ryan Walker, our expert here in HTV, our dental expert. We'll take a short break. A lot more right after the break. Don't go away.
Watch your mouth.